Hey guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today we are going to be talking about microscopic colitis. Before we go any further, I want you to understand that this video is for educational purposes only. If you have any questions or concerns, always consult with your primary care physician or your physician assistant. What is microscopic colitis? Microscopic colitis is a chronic inflammatory condition of the colon that causes persistent watery diarrhea. There is a twist to this. Usually the patient undergoes a colonoscopy, which looks normal to the naked eye. The inflammation is only visible under a microscope, hence microscopic colitis. Microscopic colitis is often underdiagnosed as the cause of chronic watery diarrhea, especially in middle-aged individuals and older individuals. There are two types of microscopic colitis. The first one is lymphocytic colitis, which is increased lymphocytes in the colon lining. The second one is collagenous colitis, which is thickened collagen layers beneath the colon lining. What are the causes or some of the most common risk factors for microscopic colitis? The causes is still not 100% understood, but some of the causes or risk factors include the intake of NSAIDs, such as ibuprofen, naproxen, PPIs, proton pump inhibitors, such as omeprazole, pantoprazole, some medications that treat depression, aspirin, statin, and this is very, very, very big. Smoking. Smoking is a strong association, especially with collagenous colitis. Older age, greater than 50 years old, and female. How do you diagnose microscopic colitis? Usually the patient undergoes a colonoscopy, which looks completely normal to the naked eye. The endoscopist takes random biopsies. The biopsies are taken to the pathology department, and under a microscope, it will give you the answer, hence microscopic colitis. Something else that you have to make sure you get is inflammatory bowel disease workup and infectious stool workup, because both of them could give you the same symptoms. Now, the thing is that the bloody diarrhea is usually not present in microscopic colitis. What is the treatment for microscopic colitis? The treatment is actually very effective. So the first thing that you have to do is to remove the offending agents. For example, smoking and medications. 2, you have to start an antidiarrheal medication, such as loperamide. 3, the first line therapy for microscopic colitis is oral budesonide. 4, individuals that do not respond to the management, the initial management, then you may need to start Pepto-Bismol, cholestyramine, and in rare cases, immunosuppressants. In conclusion, microscopic colitis is the most common cause of chronic, watery, non-bloody diarrhea. Microscopic colitis is diagnosed with a colonoscopy, and the endoscopist has to get random biopsies because the condition is diagnosed via microscope, hence the name microscopic colitis. Some of the most common offending agents are medications such as NSAIDs, PPIs, and smoking, to name a few. The good thing is that the patient usually responds very well to the treatment by eliminating the offending agents, eliminating smoking, starting antidiarrheals, and budesonide orally. In extreme cases, the patient may need an immunosuppressant, but this is in extreme cases. Lastly, if you found this video helpful, don't forget to follow Gastroenterology Simplified for clear and simple medical education. I'll see you in the next one. Bye.